Hello and welcome back to my channel. Please click the follow button, like the video, comment, and share the video. Recently, Isabella Strahan, the daughter of Michael Strahan, revealed that she has been fighting medulloblastoma carcinoma. Medulloblastoma is the most common rare malignant brain tumor in children and young adults, generally affecting about 300 children per year and 500 adults per year, with most cases being seen between the ages of 5 and 9. It is categorized into 4 subtypes. This tumor is rarely seen in anyone over the age of 30. It is located in the lower part of the brain known as the cerebellum, generally in the middle of the fourth ventricle. The cerebellum is responsible for coordination and balance. So it's understandable that this tumor would affect balance and coordination, and that would be seen in the symptoms and signs. It has a slight predominance to affect males more than females. What are the symptoms? Nausea, vomiting. You have nighttime or early morning headaches. Hallmark of most brain tumors in children is early morning headaches and early morning vomiting. The person is also tired, or there's a change in the level of activity, double vision, head bobbing, lethargy or confusion, nystagmus, which is side to side eye movement, hydrocephalus due to the obstruction of the cerebral spinal fluid, which we're calling CSF. If there is metastasis, which is spread of the cancer, is generally going to go to bone, so to the spinal cord. There will be complaints of back pain, problems walking, problems with urination, or there could be a change in the bowel function. But as we said, because the cerebellum is responsible for coordination and balance, we would expect to see coordination problems. There may be handwriting problems. Person becomes clumsy. Their difficulty walking, or it just seems like they may be drunk or off balance. We diagnose this first and foremost by history and then a physical exam. So we're taking the history of what's going on with the person, speaking with them, and then we're going to do a physical exam. The diagnostic physical exam that we're going to do is a neurological exam. From there, we're going to go and do an MRI of the brain because we're looking for this tumor. We will then do, upon finding the tumor, a lumbar puncture. In lumbar puncture, we are looking to see if there is any metastasis, the spread of the cancer cells into the cerebral spinal fluid, the CSF. About a third or 33% of medulloblastoma will metastasize to other parts of the brain and the spinal cord. And lastly, we will do a biopsy. Treating this, the goal is total resection or removal of the tumor, or as much as possible. Surgery is then followed by radiation to the tumor, brain, and the spine, and then followed by chemotherapy. Also a part of the treatment, it is offered to the patient to possibly be placed into a clinical trial. The clinical trial is a targeted therapy, and the goal of this is to block the signals that cause the cancer cells to grow. What are the long-term effects of medulloblastoma? 30% of medulloblastomas relapse. Side effects of chemo and radiation could lead to learning and memory problems, and also, of course, the location, right? Hearing loss, fertility problems. There could be a change in the endocrine function, heart problems, lung problems, and other cancers or second cancers could also occur. We tend to do survival rates through or prognosis by 5-year and 10-year survivals. So the 5-year survival for medulloblastoma is from the ages of 15 to 39, 78% when all 3 methods are used. That is with surgery, radiation, and chemotherapy. The type of cancer that Isabella was diagnosed with is WNTType. Remember I told you there were 4 subtypes of medulloblastoma. WNT is WNT, and it stands for wingless integrated. This is the least common type of medulloblastoma, occurring about 10% of the medulloblastomas. So it is the least, it's even more rare, right, to get this type. However, this has the best prognosis. This type of medulloblastoma affects males and females equally. It is most commonly in older children and teens. It rarely metastasizes, and there's rarely any recurrence once there's treatment. The survival rate of this type of cancer that Isabella has been diagnosed with, WNT, exceeds a 90% survival rate in 5 years. Really almost up to basically a 98% survival rate for 5 years. Please go over to her channel. She has a YouTube channel where she's vlogging her journey, and proceeds, I believe, are going to Duke University. I'm going to link her information and her channel in the comments, or I'll put it on the video, so you can copy and paste and go to visit her channel and support her. Leave words of support, just say, hope you're having a great day, keep going. You never know just how simple your words could be, and when someone just needs that little support of say, hey, you're doing good, you're gonna beat this. Thank you for watching. Once again, if you haven't followed, please follow, comment, share, like, drop some things you would like for me to speak about. And once again, thanks for watching.